Welcome to the Just for the Health of It podcast, interviews with local health experts. I'm your host, Drew Crawford. I'm a public health educator here at Warren County Public Health. And today we're excited to talk with somebody very near and dear to my heart, my own father, Todd Crawford, a research scientist with New York State Department of Health. We're going to be talking about indoor air quality, one of the most riveting topics that you can research on. But, Todd, thank you so much for taking a little time out to speak with me about indoor air quality. And before we jump right into it, is there any special fun facts about you? Anything that you would like to talk about, your credentials, anything like that?
Well, as you said, I'm a research scientist at the New York State Department of Health. That job is not regulatory, so I don't have a list of regulations that I tell people what they have to do. Indoor air quality comes under that category. We tend to go ahead and tell people these are the best things to do. And we spend a lot of time finding out or researching problems and then trying to find the best solution. Just as far as myself, as you know, I have been at the health department for about almost 18, 19 years. Started here in 2004. And I have been, prior to that, I was a consultant doing a lot of work with train derailments and large chemical spills and chemical fires across the United States. And prior to that, a lot of work on petroleum, degradation, remediation, site cleanups, very large site cleanup in Rhode Island. And fun fact, I spent a summer way back working in Barrow, Alaska. Went out in Barrow, Alaska and spent my summer working on the site cleanups of what's called the DEW line sites, distant early warning radar systems, which we used to have to warn us of the Russians firing missiles to us. So that was a big site cleanup that was very entertaining. That's my first sighting of a polar bear, right up close and personal. And as the background, the education, I'm a chemist, and I got my degree in chemistry from the University of Washington. I was born in Alaska, and I went to high school in England, and came back to Washington and went to university there. And from the University of Washington, a series of contacts and connections got me into the consulting field and the chemistry field up to where I am today.
All right. Well, nationally, as we're jumping into indoor air quality is something that not a lot of people talk about. It doesn't come up in a lot of conversations, but it's still super important. 1/3 of the entire world's population is hugely affected by indoor air quality. They're using stoves and open fires in order to cook their own food, which can lead to massive amounts of pollutants in the air. And we have that even in here in Warren County and in the United States and New York. Homes are getting tighter. The tighter the home, it's easier to heat. You're not losing as much heat. So it becomes much more energy efficient. But with homes getting tighter, there also comes the issue of, well, now the things that I want to get out can't get out. So for somebody like you with your expertise in indoor air quality, how does that happen? How do homes get tighter, but the pollutants in the home, how do they get out of the home?
Well, there's a couple of different things. First of all, the homes got tighter really as a fallout or a feedback from the OPEC oil crisis back in the 70s. So back in the late 70s, the oil producing countries embargoed oil and said they wouldn't supply enough to the United States. And the response here in the States was to make things more efficient. We focused a lot on vehicles and homes. The buildings in the United States are responsible for about 40% of the energy use in this country. So that covers an awful lot of stuff: the electrical systems, the heating systems, the telecommunication systems. They all use a lot of energy inside homes. And so we've made a very concerted effort to improve efficiency in all ways. So buildings became tighter. Once you've heated up the air inside the home, you don't want to go ahead and blow all that nice warm air out. You want to keep that warm air in. We also made the systems much more tightly insulated. so that it would take less energy to heat up the home. We'd keep more of that heat indoors. And as you say, a lot of the combustion sources that we have inside homes, your gas-fired furnace, your gas-fired hot water heater, we've got oil heated systems. Even in some places, we still have coal and wood burning systems. But all of those were designed to become much more energy efficient. We tried to decrease the amount of time that those heating systems were on, and also increase the amount of heat that we were getting off of them. So they've really been extraordinary advances, excuse me, in the quality of the heating systems and of the way that we heat homes and the way that we keep energy inside homes. But as you say, that has also contributed to problems with our indoor air quality. We spend 90% of our time inside of a building. And that's not just inside of your home, it's inside of a school, it's inside of your office, it's inside of your car, it's inside of your gym. So there's actually much less time that we spend outdoors than we ever have in the past. And this leads to an exposure to a wide range of contaminants that, or potential exposure to a wide range of contaminants that really aren't an issue when you're outdoors. Typical example would be something like radon, where our exposure outdoors is minimal, but certainly our exposure indoors can be quite substantial. Carbon monoxide is a tremendous threat indoors. We've got lots of combustion sources. As you say, we want to exhaust the air and make certain that those combustion sources go outside so we don't have the carbon monoxide gases. The other thing that's really come to the front recently is the infectious aerosols, the concerns about COVID, but also more recently, the concerns about respiratory virus, the RSV. We're seeing a lot of biological transmission inside buildings. We know that this is occurring inside buildings, not outside, and it's related to the ventilation inside the building. We look at ways that we have to improve the ventilation of the building to prevent the transmission of these diseases. There's a lot of secondary concerns or other issues that go on inside the indoor quality. For instance, when the pollen counts are high, how do you go ahead and minimize the amount of pollen going into the indoor air? When we have air quality advisories and we have high ozone pollutant days, then how do you minimize your exposure to those pollutants? You want to have fresh outdoor air coming into the house, but if the air outside isn't that good, what are you going to do to try and control that pollution source and make certain that people stay healthy and comfortable inside the building? So there's a lot of different factors that are at play. We've become very sophisticated at how we build. There's a lot of good stuff, but there's also a lot of things that change when a house is in use. Nobody keeps their house the way it was when they started. Nobody keeps their office building or their school the way it was when it was designed originally. So we tend to go ahead and make adjustments. Sometimes the adjustments are to go ahead and add a room or to put up a wall, not necessarily thinking about what that does to the airflow through the house or through the building. We tend to go ahead and do that because I need a bedroom, or I need more office space, or I need to go ahead and have a divider between myself and the next office, and not necessarily thinking about how did the air move. The air was originally supposed to move through that space. Now we've got a big wall in the way. So we spend a lot of time troubleshooting what should have been and what could have been and how it is now, and try to go back to the way things were designed, or else figure out ways that things can be improved once the changes have been made.
Yeah, definitely. And one thing that you pointed out was carbon monoxide, and that's a huge thing, especially coming around the winter time. Making sure your carbon monoxide detectors are working. Make sure that they aren't expired. Make sure that they have their batteries, or they're plugged in, or make sure that they even work. I know for New York State, they had the Amanda's law, which required buildings to have carbon monoxide detectors. And carbon monoxide is something everybody knows about. Carbon dioxide, that's stuff that you breathe out. So carbon monoxide is something a little bit different. And if you wouldn't mind, could you please kind of explain what is carbon monoxide and why is it so pivotal in public health?
Well, carbon monoxide is formed from things burning. And so a lot of our combustion sources give off carbon monoxide. It's not a major product of combustion, but it happens particularly with very tight buildings. You don't get enough air to make the burn complete. And so you have higher concentrations of carbon monoxide. Carbon monoxide, one carbon, one oxygen, very similar to oxygen. And so carbon monoxide acts very similarly to oxygen in your body. It binds with the blood. So your blood carries oxygen around normally. If it gets contaminated with carbon monoxide, the carbon monoxide stays in your blood. It doesn't go anywhere. So your blood becomes saturated with carbon monoxide. Once you get to a certain level of carbon monoxide, then you become very, very sick. And in some cases, you can die. So a few years ago, well, 2010, Amanda Hansen was staying at a slumber party at her friend's house over in Buffalo, and the furnace malfunctioned in the home. And so Amanda was the one that died, and several of the children ended up in the hospital. And the Hansen family started the Amanda Hansen project with the idea of requiring carbon monoxide detectors in the homes. And the current requirement is that all homes have to have a carbon monoxide detector outside the bedroom. So within 10 feet of the bedroom door, there should be a carbon monoxide detector in your home. And that is the requirement for all homes in New York State. Technically, there's a caveat that says only if there's a combustion source, but there's almost no homes that have no combustion sources. So as far as we're concerned, the requirement is a carbon monoxide detector outside each bedroom. That requirement is great, but the other thing to realize is that a carbon monoxide detector has a lifetime. As you mentioned earlier, carbon monoxide detectors rarely last more than 7 years. The little sensor inside them is actually a chemical sensor, and eventually the chemicals dry out. And after 7 years, they're not any good. You can't actually tell when you press the button, the test on your carbon monoxide detector. All that is testing is the little buzzer, the alarm. It doesn't actually test the detector. So if you take your detector off the wall and look on the back of it, you will see an expiration date. And actually, it's not an expiration date, it's the date on which it was actually installed or manufactured. But if it's gone more than 7 years, it is time to replace that. And they're very reasonable costs. And it's definitely worth the expense to replace those. The other thing also is that, as you know, the batteries die and rarely, rarely last a year. We prefer to go ahead and advise people just to replace them every 6 months. Whenever you have the time change, daylight savings time, go ahead and replace the batteries in your carbon monoxide detector. It's a very quick and easy thing to do and keeps them running beautifully. They will go ahead and help you and alarm for you. And we like to think that they will prevent deaths.
Yeah, absolutely. And carbon monoxide is one of those things that a lot of people, once they learn about carbon monoxide, go, oh, that's why I was so tired all through winter. Carbon monoxide is, granted, I've been with you my whole life, so I could probably give you the presentation on carbon monoxide by the end of this. But carbon monoxide is one of those things where it's colorless, it's tasteless, it's odorless. There's really no real way to detect if you are at risk of having carbon monoxide poisoning. And that's why having those detectors is such a pivotal thing. We talk about with people turning on their gas stoves and people turning on their gas fire water heaters or their gas fire, the heating all throughout the house, using campfires, the wood fire ovens or things like that. And those things are great when the stuff that you don't want in your house is not in the house. But when those things get into the house, and like we said, with the houses getting tighter and really having nowhere else to go, that's really that can be it could be a huge issue for the winter, and for a lot of families. So in your opinion, what do you think is the biggest issue with carbon monoxide? It's something that is virtually undetectable. It happens most every year. What's the biggest barrier to getting people to realize, oh, carbon monoxide is a problem?
Well, I think there's a couple of different things that contribute to the problem. As you say, it's a gas which you can't detect. You don't know that you're being exposed. The only thing that you have in your home that can help you is your carbon monoxide detector. The other thing is that the carbon monoxide detector doesn't go off at low levels. A carbon monoxide detector is designed to protect you from dying. It's not actually designed to protect your health as much as people think. So the symptoms of low-level carbon monoxide exposure are very similar to any typical cold or flu-like illness. People will report headaches, they'll report nausea, they'll be confused or tired, and those symptoms don't go away. They persist for a long time. We often hear from school nurses that talk about students coming in. We get requests from parents that children have been sick for extraordinary long periods of time, and I've given them different medications, and they've seen the doctor. And people don't associate those things, particularly as you say during the wintertime, they don't associate those health symptoms with carbon monoxide exposure. I'm not saying that you should assume it's always carbon monoxide exposure, but you should go ahead and check with your doctor. There are tests that can be done, and it's worthwhile bringing it to their attention. This last winter, we replaced the furnace in our home. And when that furnace was outside in the driveway, I was appalled to realize that we had actually burned through the back of that furnace, and that we actually did have combustion byproducts going into the house. And that did not cause our carbon monoxide alarms to go off. When you have a look at it, the carbon monoxide alarm is designed not to go off. It is actually designed to not go off at low levels of about what they call 30 parts per million. And yet that is more than the World Health Organization recommendation to avoid concentrations above 9 parts per million. So the carbon monoxide detectors are really, when they do go off, people should take action immediately and get out of the home and assume the worst. Call the fire department and ask for help. Don't go around looking and figuring out what's wrong with the carbon monoxide detector. If you've been looking after your carbon monoxide detector, then it will try and look after you. It will let you know. But we find that that people go around the home trying to figure out why the carbon monoxide detector is going off, or they take the batteries out and say, I don't want that noise. And that also contributes to problems. So the main issues that we have with carbon monoxide are that the symptoms mimic respiratory diseases. So during the wintertime, people feel sick and they don't associate with carbon monoxide. And the other thing also is that when the alarm goes off, people don't realize that that really is a life-saving device. They are designed to go ahead and tell you to get out of the house, get some fresh air, and then find somebody who can actually do the investigation. And the fire departments are much happier to come in and investigate an alarm going off than they are to come and find people in a house after a tragedy has occurred. So this is something where, you know, if you do have a concern, if you think that something's happening, contact the local fire department. You don't need to call 911. You can call them on the office phone and say, I think I've got a problem. They will send a truck by, and they will have very nice, sensitive carbon monoxide detectors. They can walk through the house and say, this is your problem, or we do have a problem here. So definitely take advantage of your local resources. Get in touch with your local code officials if you're dealing with an apartment, or with your local fire department if you're worried about your own home. But talk to them and ask them for help if you think that there's carbon monoxide.
Exactly, as you said, you know, there's lots of local resources, including our local fire departments. You know, for us, we don't necessarily have any big air testing facilities up here, but what we do have are plenty of local fire departments that would be more than willing, as you said, to go and rather see you outside in hysterics than you inside and after a tragedy. You know, that's definitely something that they would rather see. But, you know, as we're talking about this, you know, there's a lot of people when they think of carbon monoxide, or, you know, if they even do think about carbon monoxide, a lot of it goes immediately into my gas fire heater, my gas fire water heater, things of that nature, the gas fire furnaces, things like that. But there are more sources of carbon monoxide within the house. You know, when you close your garage door and you start up your car, you know, to warm it up, you're letting carbon monoxide into the house. You know, things like generators, you know, gas fire stoves, you know, don't try to heat your stove. Don't try to heat the whole house with the stove. You know, I always like to, whenever I talk to people about indoor air quality, I always bring it back to, you know, you and mom, when we would have the AC on in the summer and I would open the door and I'd leave it open and you'd say, you know, I'm not paying AC for the entire block, you know? So, there's a lot of sources. And, you know, if you wouldn't mind going into like, what are those sources and what can we do as individuals who may not, you know, have the resources to go out and reach out to somebody and talk about carbon monoxide? But what can you do to prevent yourself from getting carbon monoxide poisoning, or, you know, exposing yourself to those pollutants?
Well, as you said, the big problem right now is the unknown sources or unrecognized sources. For instance, as you mentioned, the garage. Very common right now to go ahead and open the garage door, switch on the car, go inside, fill your coffee cup, get your books together, go get your stuff together, come back out to go ahead and get in the car. During that whole process, the time, the carbon monoxide is coming out of the exhaust pipe of your car. Now, a lot of people assume that that exhaust will go outside, or if they leave the garage door open, it will go outside. But you have to remember that your home is being heated and warm air rises. So as the air is rising in your home, other air has to come in down at the bottom. And the air source that's available is from your garage. So when you go ahead and put your car or start up your car in the garage, that exhaust is actually being drawn into your home. Even if the door is closed, that door is not airtight. The air will come in under the door or around any other penetrations and get into the home. If you have bedrooms above the garage space, those bedrooms are impacted heavily. So there's a lot of air movement that goes into our homes, and a lot of that air is coming in from the garage. So that particular source is very critical. It's very important that you understand that. The other thing related to that right now is the keyless ignitions. A lot of cars are being left running when people think that they have switched off. As you know, a lot of the new cars have a non-idling feature. Instead of just idling in the driveway, they will switch off until they actually need some gas, and then they will start again. You'll notice it a lot when you're at the traffic light, that the cars next to you will suddenly switch on instead of just idling next to you. But this is misleading at home. People will get out of the car, walk into the home, and forget that the car is still on. They didn't actually press the ignition switch to turn it off. And we've had several very unfortunate tragedies where the family was poisoned, oftentimes in their sleep. They went upstairs and went to bed without realizing that the car was never off, and their car is in the garage below their bedroom. And the next morning, you know, the family didn't answer any phone calls. So we're very concerned about that side of it. The automobile ignition is a huge factor. The alternative heating sources, certainly as far as what we're dealing with right now with extraordinary heating costs, people are looking at using portable heaters, propane heaters, little gas fire heated heaters, things that were designed to be out on the patio, things that were designed for you to go ahead and sit outside and enjoy the outdoors, even when it's, you know, a cool fall day. If you can go ahead and just crank up that little propane heater, or maybe if it's a work heater that you have a little salamander that's designed to be used out in the garage or the workshop. And people are bringing those indoors. There's a fire risk from those, but there's also a carbon monoxide risk, and they're very dangerous. The the short answer is don't do it. There's the other source that you mentioned is the portable generators. And portable generators are often called into service when there's a power outage, when there's a storm, when we have a winter storm. And invariably during those sort of events, we have tragedies where the portable generator was used too close to the house, where it was used in the garage, where it was used inappropriately, and the carbon monoxide comes into the house, and the family, I think, it's very, very sick or worse. And those things are also difficult to avoid during power outages because carbon monoxide alarms, unless they're battery powered, they may not go off all the time. They may not go off immediately. So we see lots of reports of carbon monoxide poisonings associated with power outages, and usually it's the portable generator. The other part of that, not necessarily a portable generator, but during the power outage, people will look for an alternative heat source. And this is where you find things like the barbecue grill being brought and set by the door so that people can have a little heat source. Again, one of those things where if you don't know the way that air moves in a building, you would think that having that source near a door or a window would be okay. That would be, it would naturally go outside. But no, the air is naturally coming indoors, especially during a storm or during winter. The air is moving upwards through your house. That upwards movement sucks air in at the bottom of your house, and consequently anything that you're using to heat your house, that air gets moved up into your breathing space, up into the rest of the room. So we often have reports of poisonings from charcoal grills, barbecues, various things like that that are used on the doorstep or used somewhere where they thought it wouldn't impact the rest of the house, but it does.
Yeah, absolutely. And, it's very important that we bring that up. And it's not just, we spend, like we had said earlier, Americans, 90% of we as Americans spend 90% of our time indoors. And the contaminants indoors can be 2 to 5 times higher than they are outside. And, as we also touched on, there's a huge, I was reading in the New York Times earlier, they called it a triple-demic. I wouldn't say it's an epidemic or a pandemic, but, we have COVID going on. We have RSV, as we said earlier, we have the flu, you've got things like colds, you've got stomach bugs going around. And it's not just at home that those things can be an issue. That can also be an issue within schools. And what do you see as far as making sure that not only is your child healthy at home, but that they're healthy inside the school as well?
Well, schools are very concerned about the indoor air quality right now. Certainly when COVID hit, it highlighted how easily it was transmitted through the air. And schools are one of those very social situations. You go ahead and put 20 kids together in a classroom, and they are generating aerosol all the time. All of our activities create contaminants in the air. So whatever the children have with them will tend to go ahead and get communicated amongst all the children in the classroom equally, which was one reason why we looked at the temperature screening, the health screening before children came into the home. Obviously, one of the very first criteria that we want people to do is don't send sick people to work or to school, or there's no reason to go ahead and share this virus. Situation was much worse with COVID because the health effects were very, very bad. But the other thing was that just any respiratory virus, the cold, the flu, please don't share it. And if you have symptoms, stay home and then come back when you feel better. The schools also looked at what could be done to purify the air. And we have seen a lot of things that have been done inside schools to try and improve the indoor air quality. The very first thing that they looked at, or that they should be looking at, is just commissioning. Is the system working the way it's designed? that all schools have some way of moving air through the building, and most of them try to meet the minimum requirements. Minimum requirements usually about 350, 400 cubic feet per minute of fresh air coming through this through a building or through a classroom. And most of them try to improve upon that, either increasing the amount of fresh air or trying to get up to what they call 4 air changes per hour, which is all the air in the room should be replaced every 15 minutes. That would be 4 air changes per hour. So if you have a 30 by 30 foot class, 30 foot by 30 foot classroom, you're trying to replace all of the air inside that classroom in 15 minutes. And if you can do that 4 times an hour, you should be able to go ahead and prevent the transmission of disease, or at least minimize that risk. The other thing that schools were told to do was to improve the air filtration. All of the schools have air filters on their fans, but they're really designed to protect the fan itself, make certain that the fan doesn't get crud on it and start getting gummed up and keeping the fan working. But you can improve those air filters. You can get better air filters. And the air filters are rated according to what's called MERV, minimum efficiency rating value, MERV. And most fans on buildings have a MERV 6 or 8. That's the blue fiber filter that you generally see on your home fan. Your home heating system probably has a MERV 8 fan on it. But a lot of air handling systems can get a bigger filter, can get a larger filter. And if you can, the gold standard is to get up to MERV 13. And that is a filter that will remove bioaerosols. And we try to recommend that a MERV 13 should be used, or as close as you can get to a MERV 13 in all school buildings. And that will help to remove the bioaerosols that we're generating. It'll increase our comfort, but it'll also go ahead and prevent or minimize the risk of transmission of disease. The 4th level, we talked about commissioning, we talked about increasing the outdoor air supply, we talked about filtration. The 4th level of protection is the portable air purifier. And a lot of schools have committed to spending money on portable air purifiers in classrooms. And these are small units that you can bring out and use during the wintertime specifically, or during times of concern about the indoor air quality. Those portable air purifiers should be rated so that you can know how much air they can treat. Because obviously, if you've got a little tiny one, it's only going to deal with a little tiny space. But if you've got a great big one, then you can go ahead and use that in a large classroom. And you'll see a little sticker on the side of the air purifier or on the packaging that says clean air delivery rate, CADR. And you want something that says what the room size is that it's meant for. And usually it'll say something like 400, 500, 600 square feet. And then underneath that, it will say smoke, dust, pollen, and it will give different cleanup rates. You want to look at the rate for smoke. You want to get around 300 cubic feet per minute for smoke, because that will clean out the aerosols in the classroom. So those are the things that people are focusing on right now in schools to improve indoor air quality. Make sure the system is commissioned and working as it's designed, increase the fresh air flow as much as possible, put better filters on your air handling systems, and then put portable air purifiers inside the classrooms.
Absolutely. And, as we're talking about this, it's that time of year where, everybody's got all their germs, they're getting ready to spread them all around at school and at home and everything like that. But, with air quality, it's really hard to understand the impact that it can have unless you're the person who is researching it. It's definitely not one that you're going to go up to your friends and be like, oh, guess what I learned today. So with that, do you find that there are barriers, whether it's in the education of air quality or it's about the public policy for air quality, or is it the resources in air quality? What kind of barriers are you seeing to getting people to recognize that carbon monoxide is a big issue and it should be treated seriously?
Well, if we're talking about carbon monoxide, I think New York State is cutting edge. We're pretty good. We're not doing everything that we can, and I still find a lot of work needs to be done. But I think that, number one, we're one of the few states that requires carbon monoxide detectors in all homes. We're also one of the few states that has a requirement of carbon monoxide detectors inside commercial buildings, which includes schools. We tend to regulate based on disaster, and that is always the worst situation. The requirement for commercial carbon monoxide detectors came because of a restaurant tragedy. The manager went downstairs into the basement of the restaurant and he never came out. The assistant manager went downstairs to check on him and she never came out. One of the staff was going to go downstairs and the waitress said, "What are you guys doing? Stop." And she called 911, and as soon as the emergency responders walked in the door, all of their little portable carbon monoxide detectors went off. They emptied the restaurant, and it was as a direct consequence of that tragedy on Long Island that we are required to have carbon monoxide detectors in all commercial buildings now. So I think that from that aspect, we do a good job. We've got a good set of standards. It can be better. The carbon monoxide detectors, as we've mentioned, are designed to save your life. They're not designed to protect your health. So one of the things people can look at is, or need to be aware of somehow, and I don't know what the mechanism is, but somehow they need to be aware of that distinction, that you will, when a carbon monoxide detector is going off, that means your life is in danger. And that's something that people don't necessarily realize. The part of that is the requirement in our regulations that the carbon monoxide detectors have to comply with an underwriter laboratory standard, 2034, UL 2034. That is the standard that says that the carbon monoxide detector can't go off until it gets really high. And so that is a standard that probably should be removed from the codes, but we need to go ahead and find a new standard to put in there, something that it does make them more sensitive. So right now, I'm glad that we have a requirement for carbon monoxide detectors in all buildings, but I'm also disappointed that it's not a sensitive carbon monoxide detector. So I'd like to see something better there.
Well, absolutely. And, being in the position that you're in, being in New York State, you guys have a lot of resources at your disposal, really. And for somebody like here in Warren County, is there any initiatives or resources that you guys have where, maybe somebody's listening to this podcast and they go, "Yeah, that wasn't long enough. I need to, read up further up onto it." Or maybe some kid was like, "Wow, I really want to study air quality listening to this," and he wants to learn more about it. Are there any initiatives or resources currently available to address indoor air quality and any questions somebody may have?
Well, we always encourage communication of any sort, but a lot of that's individual communication. So a podcast like this is a wonderful opportunity to share the word. And, even if people drop in for just a few minutes and catch some nugget that they can use, that's wonderful. It's very difficult to find one outreach tool that seems to communicate with everybody. As you know, trying to use social media, using the podcast systems, we spend a lot of time at conferences, but it does seem that the message gets missed in different places. I was at the fire marshal's conference talking about carbon monoxide, and it was appalling to me that afterwards, 3 fire chiefs came up to me and said, "Hey, you know what happened to me?" And I'm going, that shouldn't be happening. You guys are the experts. I'm trying to go ahead and make you go out there. And I don't think that although they know what the risks are, they still didn't recognize it when it happened to them. So I think there's a lot more to be done. We do see a lot more outreach during storm events. A lot of the counties do come out with more information about carbon monoxide, portable generators, flooding awareness, all sorts of different things associated with emergencies. And I think that's wonderful information. I don't know how to make it a daily topic of conversation. You have to suffer with it because it's my daily topic of conversation. But in a normal household, I just don't see this coming up. And this is something that we were lucky with COVID. COVID did make it a topic of conversation. COVID made face masks acceptable, useful. It made us talk about improving the ventilation in buildings. It made us talk about improving filters. It made us talk about getting portable air cleaners into the spaces. And I sort of hope that doesn't fade, but I think it will. I think that, obviously it can't be important forever. So we need to either hope that we don't have a tragedy, or if we do have a tragedy, we'll be cast in the forefront again, and we'll have to start working with it. But I think that it's important, the work that you're doing in the local area, because I think that you get a chance to be in a school or in a building or in a business and be able to go ahead and say, over there, is that carbon monoxide or is that a smoke alarm up there? And you'll be surprised, most people can't tell the difference. And you can't recognize it very easily. And so you have to actually put them on the spot and say, can you tell me about that? Does a hotel pool have a heater? And do they have a carbon monoxide alarm associated with that heater for the hotel pool? Because we often see where the exhaust from those pool heaters comes up into the hotel. It doesn't actually go out the side when people say that they think that where they think it's supposed to be going. How does that become a topic of conversation? You have building officials, code enforcement officers that are going into buildings and investigating complaints. If they're investigating a complaint, do they cast a glance over at the wall and say, oh, I see you don't have a carbon monoxide alarm in here? Is that part of their consciousness? Is that something that we can ask the county health departments to meet with their counterparts in the building departments and DPW and say, are you guys aware of that risk, and do you take that into consideration when you walk into a building? A lot of the officials were putting on face masks and being cautious and putting on gloves and such before they walked into buildings, but they weren't cognizant of some of these other threats. And that's something that it should be part of their daily consciousness, part of their precautions that they take, not only to protect themselves, but also as a sidebar, they're able to go ahead and spread that information to the audience that they're dealing with.
Mm-hmm. Yeah, absolutely. And, as you said, I'm one of the lucky few that gets to listen to you talk about carbon monoxide. But, it's one of those things where you never realize how big of an issue it is until you learn more about it. And you also never realize how serious it can be until you learn more about it. When I'm in my chemistry class and we're talking about compounds and, carbon dioxide or, sulfur dioxide or whatever, there's a lot of these compounds, but we never talked about carbon monoxide. We never talked about how carbon monoxide is colorless, it's tasteless, it's odorless, how you really have no idea that you're breathing in, you're being exposed to carbon monoxide. And the next thing you know, you're not waking up. And that's something that can be extremely serious. And I think that the education piece in particular is really something that can always be improved upon. Everybody can always know a little bit more about a topic. Everybody can always know a little bit more about certain things. And, for you, do you have any tips or advice or any words for somebody that, I'm in my home, what do I need to do for the winter to make sure that my family is safe and is not exposed to carbon monoxide or any other pollutants that can be byproducts of combustion.
Well, I think everybody in their homes should be at least checking their heating system, making certain they know that it's working the way it's supposed to. That includes changing the air filters. That includes checking the exhaust and making certain that the exhaust doesn't get covered by snow during the wintertime. Making certain that things are not obstructed around furnaces or water heaters. Those closets tend to accumulate junk. And if people start putting stuff in those closets, it will obstruct the airflow around your furnaces. So those things are very important. The other thing is where does the air flow inside the home, and do you make certain that the vents are open and flowing freely instead of having a dresser standing in front of the vent or putting cardboard over the duct to make certain that it's not blowing cold air on me during the summer, but now I didn't take it off during the winter time, so it's not blowing any air into my room. A lot of it's just making certain that the air moves. And that's really probably the most important thing that we are concerned about. The other thing also is to check on the placement. Where are your alarms? Are they someplace that they're going to go off? That's probably not something which people like to hear very much. They don't want to make them go off. But if they're not going off, then that's a good thing. If you put them someplace where they're near a combustion source or they're near your bedroom and they don't go off, that's a good thing. And we want to go ahead and have them placed somewhere where they'll wake somebody up, they'll alarm somebody and get them out of the house. And the other thing also is don't second guess the alarm. One of the worst things that we do all the time is start taking the batteries out and checking the alarm when we should be getting outside of the house and calling 911 and asking somebody to go ahead and take a look around the house. So it's being very cautious about yourself and about your family. Being aware of the health effects that don't go away. If people are sick, if the children are sick persistently, no matter what you do, that's not normal. That's not something that, a lot of people will go ahead and say, well, maybe it's a virus, maybe it's mold, maybe it's not, maybe it's carbon monoxide. The symptoms are very similar, and you will tend to go ahead and miss that. And the doctors will often miss it. It's not something which they normally think about. So that's something that's very important to you as a parent, is to be aware of the health of your family, your children, and see whether or not that is a possibility.
Yeah, and lucky enough for us, we're very health oriented working family. So air quality and carbon monoxide are always topics of conversation. But as we're wrapping up our podcast here, are there any last words, anything that you would like to add, anything that I glanced over and I didn't go quite deep enough for you? Is there anything that you in particular really want to add?
I think that the important message for all of us here is keep it simple. We all are looking for we tend to confuse indoor air quality with comfort standards. We sort of think that if it doesn't smell, if it's warm enough or cool enough, and we're comfortable, then it's good. As you said, the risks that we sometimes run into don't care whether it's warm or cool. They are related to other things that are going on inside the building. So people should not live in fear, but should definitely be ready to investigate further, take the next step. There's a lot of good information available online. We're getting better information out there. I think we need to go ahead and improve the outreach that we've got, because people tend to associate carbon monoxide and various other air pollutants with disasters. And really it's an ongoing issue every day. There's always something, if you can smell the bacon downstairs when I'm cooking bacon, that's actually, I'm sure everybody's going, well, that's great, that's breakfast. I'm like, no, you shouldn't be able to smell the bacon downstairs. There's something going wrong with my ventilation system when you can smell that. So it's a little wake-up call, a little warning to everybody. If I was cooking fish in the morning, you'd complain. Okay, so I want you to be aware of the fact that there's little telltale signs all over your house, and they're informative. They tell you what's going on, and if you remain awake and alert, then you'll be fine, and you'll understand that things are how things work inside your home.
Yeah, absolutely. So first off, I would want to thank my dad, Todd Crawford, research scientist with New York State Department of Health, for taking some time and talking with me about indoor air quality. I'm your host, Drew Crawford, public health educator here at Warren County Public Health. Thank you for listening. Be safe, be healthy, and we'll see you back here next time.